My name is Dalhichi. I am 32 years of age. I come from New York, USA, and my initial weight is 124 kgs. I am here to discuss my experience with the mini gastric bypass that I had with this team, with Dr. Amit Garg. My initial issues that I was facing is, of course, I was extremely overweight, and running issues into having borderline cholesterol issues, diabetes issues, joint pain issues, sleep apnea. But we had consulted with a couple of doctors in the U.S., looked at a couple of our friends who had gone through the surgery, and we had contacted Dr. Garg and his team in India to see what would be the next step to see if we can go ahead with the surgery. When we contacted them, they were very friendly and forthgiving. All the information what the next steps would be as far as following requirements as diet and life changes that would need to be done. And we came in one day, discussed everything. 2 days later, we were ready for the surgery. Surgery went through perfectly fine, no issues. Pain was minimal. Of course, that is my case. It is case to case. I was up and walking within 4 hours. Yeah. And next day, we went through the steps of release, and we were released actually 12 to 14 hours before scheduled. At this point, I'm looking at 1 week post-surgery, and I'm looking at least a 2.5 to 3 kg weight loss to begin with, and just looking forward to what we have going down the road.
There's smaller, day-to-day struggle with obesity. So I would like you to talk more about that.
It was about that, like whenever we used to go clothes shopping, he used to like something, oh, I like this shirt, I like this trousers, but it didn't fit him. And perfect example is his best friend was supposed to get married last year, but due to COVID it got postponed. So when we went suit shopping, he liked a few, but he was just a bit short for his regular size. So at that time he felt bad and he felt sad, and I could see that sadness in his eyes, like, okay, I want to fit into this, but I cannot. And that was a regular thing, like he used to like something in the regular shop, but wasn't able to fit into it. So
it's even traveling, just coming to India, the seatbelt on the plane didn't fit.
Yeah.
It's going to an amusement park and the guardrail wouldn't come down. It's little issues like that. It just contributes to your mentality that, things have got to change, and it has to be a drastic change. And this is a good, positive, drastic change where you guys set it up where you can change it for the future. It's not where you are just like one and done, because there is a responsibility on my side that I've gotten the surgery done. I need to take care of that surgery. That puts in more of a long-term commitment.
So did you try losing your weight by some other means, like?
There was always, diet, exercise. We went through the GM diet. That gave a good 15 kg, or not 15 kg, about 5 10 kg loss.
7 to 8 kgs. But then that was so strict he couldn't do it.
Exactly. So then there was repercussions on the flip side if I had tried to redo it. Exercise was there, but between the work schedule and everything, it is difficult to actually do that, because we would come home, you change, then you're ready for home, and then to mentally get ready to go out again, it was a difficulty.
And then with his weight, he needed to put in a few more hours than the regular person would have to, so that was being difficult for him.
Exactly, like putting in an hour at gym was not going to do anything. At my weight, I needed to put in 3-4 hours, and with the workload I had, that was not possible.
So did you have any apprehension regarding the surgery?
Initially, there was never any apprehension, because I knew it is an elective surgery. Especially in US, it is a normal elective surgery. That wasn't there, but it is a surgery. The people need to think that there are repercussions to it. If there's heart issues, anything, things can happen, and that's the one thing to keep in mind. In my case, I knew that, but I had confidence where we would be fine.
So why did you choose CODSILS?
we researched in the area, and we looked at, we have a couple of neighbors on my in-law side that they said they got the surgery done through you guys. We researched, and you guys were the number one team in the area.
And like when we spoke to you, when we were in US, like the first time we talked to you, and we thought that you knew everything, like you had your knowledge in this thing. So that made us comfortable and confident, like no, we are in good hands. So that's the first thing I told him when he talked to you, like, oh, I think she knew her stuff. So and then we researched and we found out, no, like you have done so many surgeries, so of course it's like, no, we are at the right place. And the whole team has been very supportive. Like whenever we message, they reply right back, and we feel more confident with that. Like they're always there for us.
Yep.
Excited?
Excited.
That's it. Thank you so much.